On Tuesday morning, U.S. federal health regulators recommended a pause in the use of Johnson & Johnson's COVID-19 vaccine while they investigated 6 reports of blood clots in women ages 18 to 48. One has died, and a second is hospitalized in critical condition. As of Tuesday, 2 million people in the United States had received the vaccine without any other serious adverse reactions reported. Experts have yet to determine to what extent, if any, the vaccine is responsible for the clots. But the investigation follows actions by European regulators who concluded that a vaccine made by AstraZeneca may also be the cause of a similar, extremely rare clotting disorder. And European public health experts have emphasized that for most people, the benefits of the COVID vaccines far outweigh the risks. Several countries in Europe last week restricted use of the AstraZeneca-Oxford vaccine to older adults because rare cases of a blood disorder were occurring in younger people. The AstraZeneca vaccine has not been authorized in the United States. Fewer than 1 in a million J&J vaccinations are now under investigation. If there is indeed a risk of blood clots from the vaccine, which has yet to be determined, that risk is extremely low. The risk of getting COVID-19 in the United States is far higher. The FDA recommends that people who have received the Johnson & Johnson vaccine within the past 3 weeks should contact their doctors if they experience severe headaches, abdominal pain, leg pain or shortness of breath. Doctors seeing people with those symptoms, particularly if the patients are young women, should ask if they recently received a COVID vaccination. Dr. Anthony Fauci, the Biden administration's chief science advisor, said at a news briefing on Tuesday. People should not be concerned about mild headaches and flu-like symptoms in the first few days after vaccination. Those are common, harmless side effects brought on by the immune system's production of a defense against the coronavirus. For people who received the vaccine a month or 2 ago, the issue being raised about clots doesn't mean anything, Dr. Fauci said. The 6 cases occurred within a pretty tight window of 6 to 13 days after people received the shot, he said. During clinical trials and after vaccines go into wide use, experts keep track of any medical problems experienced by people who receive them. If an unusually large cluster of cases turns up, regulators may decide to pause the trial or stop the use of a vaccine to investigate further. Pauses are common, and typically the investigations reveal that the medical problems were a matter of coincidence. If the investigation reveals that a vaccine does pose a risk, regulators may write new guidance about who should or should not receive it. The pause also gives them time to advise doctors about how to recognize and treat the condition.